You're tuned into the African Nutrition Society podcast. We've been deliberating on school health and nutrition throughout the pre-conference school health and nutrition workshop through to the African Nutrition Conference. We've been discussing food security, food systems, etc. And today we have with us Professor Alan Jackson. Professor Alan Jackson, CBE, he has his major interest in biological and social factors that enable optimal growth and development during childhood. He's trained in pediatrics in Cambridge and London. He was director of the Tropical Metabolism Research Unit, University of the West Indies, Jamaica, developing the evidence base for the WHO guidance on effective treatment of severe malnutrition. He has been a senior advisor on nutrition to the UK government and advisor to the World Health Organization, Food and Agricultural Organization, and the European Union. He was recently Director for Nutrition Research, National Institutes for Health Research, England, Chair of their Cancer and Nutrition Infrastructure Collaboration, and chaired the Continuous Update Panel on Nutrition and Cancer for the World Cancer Research Fund, American Institute for Cancer Research. Professor Jackson, that's a lot. I'm so humbled to be interviewing you. Yes.
It's just a daily job.
Right, it's an honor to have you this morning. Thank you. We finally made it to the interview room.
Very good.
Yes. Please tell us, you've been around throughout the pre-conference school health and nutrition workshop, and we've been deliberating on practical approaches to improving school feeding programs. And then you're still around following up with the African Nutrition Congress. We've been discussing food security, food system. What are your impressions throughout the conference?
Well, as always, they're mixed. I'm impressed and encouraged by the progress that nutritionists have made and are making in Africa.
Okay.
I first started being involved in nutrition in Africa many, many years ago. And the progress that has taken place, particularly since the formation of the African Nutrition Society meetings in 2008, has been fantastic.
Great.
And the progress in being able to organize meetings, have good quality meetings, is first class. But that's not enough. Because what we've got very good at now is talking about it, and we've got to get better at doing it.
Definitely.
And in particularly recognizing the problems that need to be addressed and organizing ourselves together to address them effectively. And that's a much bigger step, but it's an important step, and hopefully the next step.
Definitely. And a bird whispered in my ear that you're Jamaican and you have a great life with all the credentials, looking at your profile, and you could have sat somewhere in the UK and minded your business. So I'm curious about your motivation for being involved in the development of nutrition programs in the context of Africa and school feeding.
You make it sound as though it's deliberate and purposeful. So I'm a pediatrician.
Okay.
I spent my life trying to create the best opportunities for children, with a special focus on those who are most in need, least cared for, most vulnerable, but potentially the most useful to society. So I trained in pediatrics, and I went to work in a research facility in Jamaica with severely malnourished children. And it's heartbreaking to see mothers bring their children and they hope that you will be able to do something.
And you saw all of that in the UK, not just Africa?
I'm talking about Jamaica.
Jamaica, okay.
I saw it in the UK. But it wasn't the thing they cared about most.
Okay.
But in Jamaica, there was a specialist facility that was set up by the Medical Research Council to better understand what was going wrong, better understand why children died, and to work out what to do to keep them alive. Now, this was at a time when in most places around the world, 50% of the children, 1 out of every 2 child that was admitted to a care facility died. And so it was a real problem, and thanks to the research that had taken place over many, many years before I got there,
Right.
the protocols that had been put in place for caring and managing the children, progressively we were able to bring the death rate down to the point where we got it down to 0. Now that might have been good fortune, but I don't think so. Consistently we knew that if you put in place simple approaches, but you did them with care and attention, you could get the death rate down to less than 5% in most places. And where you couldn't do that, then you could go and ask appropriate questions and work out how that might be done better.
Okay.
And so we made progress in that sense. And then there were 2 questions that we had to ask. If we could save children so that they physically were okay, how about their brains and their future? And so a group started looking at the mental development and opportunities for the severely malnourished children after they'd recovered, and worked out how to put in place a program of care delivered in the home by community health aides, women who'd just been taken from the community and trained to work with the families so that they could correct or address those problems. And compared to the children who didn't go through that experience, the children who were treated in that way, they ended up being better, having a better life. They had better school attendance, they had better school records, they got better jobs, they were better people, they were better behaved. They are poor people from poor environments where crime and adverse experience is rife. So they were less likely to become criminalized, have better home lives, and bring up their children better. And then their children in turn were better. So that we knew that we could heal their body, we could heal their soul, and we could give them better opportunities in life.
Awesome.
But if you're healing, then if it's necessary, but it's much better to prevent it in the first place.
Right.
And so the question was, well, why are these particular? We know they're poor, but even amongst the poor, there are some families that are rather more likely to have malnourished children than others. So we went back and we said, well, what about the mothers? And we started to look at what happened during the pregnancies, and with an obstetrician, we looked to see how mothers fared during the pregnancies, and eventually we looked to see, well, the children that came out of those pregnancies, what happened to them and how did they do? And we found, first of all, that of course the mother's experience during pregnancy was very varied, but the women who were at greatest disadvantage in terms of nutrition, they had children that were at greatest risk, and more importantly, those children were at greatest risk of developing not just the acute problems, but the chronic problems, what we call the chronic non-communicable diseases, blood pressure, heart disease, diabetes, stroke, cancer, depression, neurological problems. They manifest risk of those diseases more, so that the way the mothers were supported during pregnancy had importance for all of those things. And we came to understand that it wasn't, women can become pregnant before they realize they're pregnant.
That's true, very true.
And very early in the pregnancy, when the embryo is just developing, it's very, very vulnerable to the nutrition environment.
Right.
We know that most of all because of neural tube defects. And there's a widespread program now to give mothers folic acid before pregnancy to stop this terrible disorder where the baby is born disabled with a wide open spine and has problems for the rest of their lives. Some of them are born with no brain and a terrible condition. But that can be almost prevented if mothers are given folic acid before pregnancy, so that in those very early days of pregnancy, when the brain and the spinal cord are forming, the mother is nutritionally adequate.
Right.
By the time the mother knows she's pregnant, that's already passed. So waiting for pregnancy, to know you're pregnant, to do something about that's too late. You have to do it before they're pregnant. Well, how many women plan or know that they're going to be pregnant? Well, it's not for me to say, but I guess it's not that many. And we know that more than half of women either have, they don't plan for the pregnancy.
Even when we plan to be pregnant, we don't really think about nutrition.
Well, if you plan to be pregnant, you think about nutrition even more.
That's how
you go out and have a
be.
nice meal and you...
Right.
Well, but then if you say, okay, well, we've got to look after the women and make sure they're well fed even before they become pregnant. Well, how are you going to do that? The women aren't going to come and tell you, you don't know. And the answer is, well, the only way you can do that is if the women, the girls, and the boys learn about it as a key part of their education. So it's not a mystery. They learn about it in school. They learn about it as part of their education. There are all sorts of parts of the curriculum where that can be put in, so that by the time they get to a stage where they're ready to become parents, they know what it means to become parents. They accept the responsibility of becoming a parent. Most importantly, they recognize the nutritional responsibility of becoming a parent, and they make sure that they're in a good nutritional state before they even start to get pregnant. What does that do? Gives us better pregnancies,
Right.
less pregnancy complications,
Better outcomes.
healthier newborn babies, fewer malnourished children, better brain development, smarter kids going to school, a next generation that's so much better. So it takes 20 years to grow a person. We take it slowly, 20 years. But that whole 20 years has to be a learning experience. Well, life is a learning experience.
Right.
We wander around, children play, they make mistakes, they learn to walk. It's all learning. And decent nutrition has to be a part of that learning, so that by the time they become adults, not as a special thing, but as a matter of course, they know, understand, and own
Right.
that responsibility. Better people, better lives, better progress, all development, all social development, all national development is based upon the development of people. And if we can develop good quality people, we develop a good quality nation.
I must confess that you've explained this excellently, and I know that with every step we take in implementing programs, there are some challenges. So what would you say are some of the challenges that we have had with this excellent initiative?
With the school feeding initiative.
Yes, yes, definitely.
Okay, well, based upon what I've just said, the first challenge is that we identify it as initiative. I've already said it should be just part of ordinary life.
Right.
But we are where we are, so an initiative. So I've been telling you about the experience that we had with children who had become malnourished. Now, quite early in our journey, we started training students with Masters in Public Health Nutrition.
Okay.
And we trained them for the government service throughout the Caribbean. So the governments of the Caribbean would have nutritionists in their service to recognize, address, and deal with the problems at a national level, whatever they were. And as part of this training, the students had to do a small project. And one young lady came to us and said, well, I'm a teacher.
Okay.
She taught in a rural school, and she said, I want to learn about nutrition because the children in my class, many of them have to walk maybe 5 or 10 miles to school. They don't have breakfast before they get to school. If you don't have breakfast and you walk 10 miles, what state are you in when you get to school for learning? Not very good. So I work very hard, but I'm fighting an uphill battle because the children aren't able, however hard I try to take in what I say. So I want to do a little study where I try giving the children some breakfast when they arrive at school. You don't have a lot of money, but something simple that they can eat and then settle down to their work. And so she did a little study where for one term she gave one class the special thing, and the other class unfortunately weren't getting it, they didn't get it. And at the end of the term she assessed what had happened. And it might surprise you that the children who found that they were going to get breakfast in school were much more ready to go to school, so attendance went up.
How simple things work well.
They not only attended well, but they paid more attention. So they improved their scores. Their learning improved by a great deal. So that very simple thing changed the lives of those children for that period of time. Well, why don't all children have the opportunity, if you're going to go to school, to be able to take advantage of going to school? And if you want to take advantage of going to school, then your brain has to be ready to operate.
Right.
And it needs to be fed.
Definitely.
So that was a very powerful learning experience.
Right.
And the question then was, well, how can we extend that? How can we expand that? How might government take that up and have it as an established policy? But governments have from time to time taken on these schemes, and it's not new. Church schools in particular often provided children with food, and so it's not a new thing, but it's not a consistent thing.
Okay.
And there are, as always in life, those who need it most are least likely to get it. You know, those who are well off have ways of finding what they need. Those who are least resourced have so many problems and so many things to do in life, they can't cope with them all. So somebody has to step in and help to give them a little leg up so they can do better.
All right. This is amazing, interesting, and we would like you to share your final words, but as part of that, we are in an AI era, and looking at how excellent this initiative looks in its implementation, we would like to know how technology can be leveraged to enhance the effectiveness of these interventions.
Well,
from the simple ones to the...
Let me make the first observation that unless you start with the secure foundation, all the clever technology isn't going to help. Or put it another way, if you really want to take advantage of the clever technology, make sure you start from a good foundation.
Okay, and what's the good foundation?
A good foundation is to enable children to grow and develop well.
Right from pre-pregnancy.
Right from pre-pregnancy, but particularly during their school years when they're learning, and when they're learning to be responsible adults.
Okay.
Now, there are all sorts of programs of putting meals into schools, but what is lacking is that what those meals mean is seldom taught. You give them some food and you eat it and you go off and do what you're doing. But that is an opportunity for explaining why the food matters, why it's important. In other words, helping the children to understand food and nutrition as an integral part of their lives.
Right.
Well, who's going to give that learning? The teachers. Well, what do the teachers know? Well, nobody bothers what the teachers know. So if we don't bother what the teachers know, how are we going to know what the children learn? Well, the children don't learn. So we've got to start helping the teachers to know what they know. Well, who does that? Well, that's the job of nutritionists. Well, where are the nutritionists who are doing it? We don't have any. We haven't created a professional group of nutritionists who are skilled and understand the nature of the issue, understand what happens in schools and education systems, understand what teachers need and how they can best incorporate this into the curriculum. So it's not something separate, it is integral to the curriculum right the way through, and then responsible for overseeing it, making sure that it happens properly. If there are problems, addressing the problems and making it easier for the schools so that the schools can do well without having to think about it.
Right. Thank you so much for the insights you have shared. This is very great, and I'm happy that our viewers, our listeners are receiving these insights. And so if you're a woman of reproductive age, we've talked about preparing to be pregnant, and when you're preparing to be pregnant, you have to be conscious of the food that you take and make sure that it's a balanced meal, is providing you some diversity to be able to get your nutrients. We've talked about folic acid. We've talked about the importance of inculcating good nutrition information in school-age children so that they can also practice good nutrition themselves as they develop and grow into women who are also going to be pregnant, and the cycle continues over and over. It looks like you want to say something.
I want to make one more point.
Yes, please go ahead.
Because not inappropriately, a great deal of emphasis has been placed on women. And it's almost as though men don't play a part in this. But the onus of responsibility on men is even greater for a number of reasons.
Yes.
Most importantly, for the males to understand their role in this process is very, very important.
Yes.
But you might remember I already said that when we look at the longer term opportunities for children who've been poorly nourished, one of the benefits of the intervention was that there was less violence, they were more socially responsible, they were better people. Now, the relationship between a mother and a father, every child needs a mother and a father. The father's role is very, very important, and the father's role has to be responsible in terms of the care that they give both to the mother and the child.
Right.
I understand that inter-family violence is far from trivial. Some of this can clearly be traced back to poor nutritional issues with the father. So it's not just about women, it's not just about children, it's not just about, it also includes men, and it includes families. And if you want to have good mothers, good fathers, best example for the children, then they all need to learn as a matter of course throughout their school that this is the best way to make good people in good societies.
So everyone matters.
Everyone matters. Everybody has a responsibility and everyone has a role to play.
Definitely. Thank you for chipping in that. So this has been the African Nutrition Society podcast. Many thanks to our sponsors, especially CRS, for helping us put this interview together. My name is Helena. See you another time.